Welcome. I am Dr. Kelli Ritter, and I am going to talk a little bit about gut health. That is my favorite subject. I specialize in mental health nutrition. So, I'm a nutritional therapist, but I have 25 years of my career has been in clinical mental health. So, I made the transition to nutritional therapy a few years ago, and I started learning about gut health in 2009. I was a professor at the time in a clinical mental health counseling program for master's and doctoral level students, and loved that job. But I was teaching and started learning more about the gut brain axis, and then developed a course and started teaching in 2016 about wellness and counseling, but specifically about the gut brain axis. So that is one of my favorite things to talk about, is how to heal the gut, and and how that helps mental health as well as our health overall in general. So I get messages every day. People will message me or email me and say, how do I get started? So I thought I would give you a little bit of information about how you might get started. So most people are surprised when I say start with sunrise. That is not something that I taught in 2016. I did not even, it wasn't on my radar until I guess about a year, maybe a year and a half ago. I was missing two crucial pieces to the whole gut health puzzle. So I was really focused, obviously, on nutrition and food, which is important, but I was missing this piece of how important the sun is for information, for our mitochondria to tell the cell to make ATP, which is energy. Everything is energy. So if you go back to, well, the level of the cell, how are we going to help each cell be as healthy as possible? You got to have healthy mitochondria. Those are the batteries to the cell. What does the mitochondria need? The mitochondria need oxygen, sunshine, and food. So the sunshine piece, if you have to start somewhere, if you're wanting to start somewhere, I should say, or if you're trying to figure out, like, how do I get started with my overall health? Start with sunrise. That full spectrum of light is what you're after at sunrise. And then at sunset, you have that full spectrum again that helps tell your brain through your eye. So you're outside, no glasses, no sunglasses, no contacts, none of that. You just want to go out, be in that light. You don't stare at the sun unless you're me, but you don't want to stare at the sun, especially if you don't have your food right. You don't want to be doing that. But you want to be out there and you want to be absorbing that light so that your body is getting the information that it needs to heal. And it's an important piece of your overall gut health. So I would start with sunrise. I think that do whatever you have to do to start your day outside facing east at sunrise. The more you can get used to seeing sunset is also really helpful, but I think I would start with sunrise. That's crucial. So then you want to get your food right. Well, how do you get your food right? Well, it depends. It depends on how sick you are or how well you are, what your goals are, and how much do you want to heal. Because if you're doing anything artificial, so if you have artificial sweeteners or anything artificial in any of the food, it wouldn't be real whole food if it had artificial stuff in it. So any of that packaged stuff with artificials got to go. You got to drop it like it's hot. Just drop it. Get it out of your life, get it out of your environment. I talk about that sometimes in videos. Phthalates, get them out, just get them out. From there, so if you're doing sunrise and you've gotten all the toxic stuff out of your environment, you're not doing anything artificial. And sometimes people ask me, well, what about stevia, or what about, so eventually what I'm gonna say is get off it, all this, anything sugar, anything that resembles sugar is good. You're going to want to get rid of it. Um, you may not want to do that. You may decide that you're not going to do that. Um, so you get to decide, obviously, what you do or what you don't do, but work your way there. So if you have to use stevia or you have to use something else that's a natural sweetener to get yourself off of all the stuff, then do that. I mean, the main gut detractors are sugar. You already know that. Sugar and processed foods. It's not really food, it's processed stuff. I've got to go. You drop those like they're hot too. So, sugar, grains, dairy, soy, alcohol. What am I missing? Caffeine. These are all the gut disruptors, the things that cause problems for our gut. So the more gut problems you have, the more mental health problems you have, the more chronic disease you have, whatever you're trying to heal, the more you cut that stuff out, and you can eventually add in things like probiotics or but I think people need to do a lot of healing and getting the stuff out of your system, getting the stuff out of your environment. I used to say, well, add things in first, like do bone broth and take probiotics. But what I found is that sometimes people, that's too much, and they're already so toxic that doesn't really actually help them. They have to get all the stuff out. Well, how long do I have to do that? Well, how much do you want to heal? So, what are you trying to do? What are your goals? And I would say until you have an absence of whatever brought you to the thinking that you needed to heal your gut. So, inflammation is down, you're feeling really good, then you start adding things back and see how you do. Never going to be sugar in my mind. It's never going to be anything artificial, because artificial sweeteners are neurotoxins. That's not good for you. That's not good for anybody. This whole like everything in moderation, no, that's poison. You don't need that in your body. It's poisonous for everyone. So you might want to see if you could add some grains back. Now, gluten specifically, if you have any kind of mental health, anxiety, depression, but specifically anxiety, I'd say drop gluten, drop it like it's hot, get it out, and keep it out for as long as you possibly can. Everything else you can just kind of see how you do. Grains are inflammatory, so I would probably leave grains and sugar out forever. Alcohol, not good for your system, not a healthy thing to do. You get to decide how much alcohol you decide to have, right? So, adding things back to see kind of how you do after a time, that's completely up to you. You may feel so good at some point. I will tell you that healing the gut is slow. Healing the gut naturally takes 8 to 10 months, is what I see. So it's not, it's a marathon. I mean, it's a lifestyle change. You're making these changes. It's also about good sleep and about, which also involves the sun. So good sleep is important. Stress reduction is important. All of these other components come in. So it's not just about your food. You're using the whole thing. It's a whole lifestyle, and you're moving towards a healing lifestyle that is probably going to shift at different times in your life. So when you're saying, where do I get started? How do I get started? I would say start with the sunrise, and then do your best to get your food in a way that is healing to your body. Oh, and people will often ask me about, do I really have to do ketosis? Do you really have to do ketosis? Ketosis is a metabolic state. So it's not a diet. You can use a ketogenic diet to get in and stay in ketosis. And ketosis technically is any way of eating that allows your body to flip the switch from glucose burner to ketone burner. So from burning glucose, sugar, to burning ketones, fat. So there are different ways of eating that can help you heal. And so finding the way of healing, the way of eating for your healing is what you're after. So that's what I would say. If you want to heal faster and deeper, then you're looking at sunshine and using sunrise, sunset, and sunshine for vitamin D during the day. Or you might have to biohack that if you're in a place where you can't get vitamin D right now, and ketosis. So that is what I would say if you want to go deeper and you want to have more healing and you want to go faster. But this is not really a fast track kind of thing. To heal the gut takes, healing just takes time. You can heal fast. You can have healing in a moment. But I also think that you're in this for a lifestyle long term. So figuring out the ways that are going to be the most supportive for you to get there, whatever your goals are. And I think I already said this, but when people will say, well, how long do I have to do that? How long do I have, how long do you want to feel good? And until you have an absence of whatever brought you to healing your gut is how long you want to do that. You want to take the gut detractors out. You want to add in as much healing kinds of things as you can. And that's going to depend on you and your bio individuality and what your schedule is and all of that sort of thing and what your goals are. So hopefully that is helpful.